just they're going to be changing to the carriers, how they're taking care of it. So before you had the Anthem network. So when you wanted to find a doctor, you looked on Anthem.com and looked for a doctor. Now you'll have Medical Mutual, and you look at the med, and we're going to have this all for you. So Anthem's networks changed to Medical Mutual, and before Anthem used Express Scripts for your prescriptions. Whether you did mail order or you went to a pharmacy, it was Express Scripts that was the pharmacy benefit manager. And now it's going to be CVS Caremark. Those two are the two largest in the country. It doesn't mean you have to go to CVS. There is some benefit for going there, but you don't have to go to CVS. You can go to any pharmacy. And you also have mail order like you did, Express Scripts, and we'll go through that. Right now is open enrollment, so if you want to add a dependent, take a dependent off, make any changes, if you're not on the insurance, want to get on the insurance, this is the time to do it in November. What's going to happen is we're downloading all your eligibility, which means that you don't have to fill out forms. That's really good. So we're taking the information that's already on Anthem systems, and we're going to download it into self-funded plan systems so they can administer your information. So what's going to happen in the next couple of weeks is Jody's going to get a piece of paper that's going to be you. You know, Jeff Smith, and it's going to say your dependents on it, your address, and all of this. Now, of course, your date of birth hadn't changed and all that, but look through that information and check off and make sure your address hasn't changed. And then you'll sign off on that and give that back to Jody. And that way, January 1, you will have everybody in the system. If you don't turn that form back in, then how your insurance is set up right now, as far as all your dependents and everything, will be the same January 1. So make sure you turn that back in. Check your address. If you happen to be pregnant and you have a baby between now and then, say in December, then you'll have to tell Jody about it so we can add the baby on, that kind of thing. We're also going to hand out some different stuff on wellness and employee assistance programs, which are new, and we have a new contact sheet for you. So I'm going to let Jeff, he's with Self-Funded Plans, run through this slideshow a little bit, and then I'll be back in a couple minutes.
Okay, good afternoon, everyone. What's everybody doing? Ready to get out of here, right? My name is Jeff, as Larry said, and I work for Self-Funded Plans. Self-Funded Plans is going to be your claims administrator starting January 1st. So think of us like you would think of Anthem. We're the ones that are going to be processing the claims, working with the providers, coordinating with the pharmacy. We're doing all those things for you now starting January 1st. And so think of us as the new Anthem. I know you guys have been with Anthem for years and years and years, and most people don't like change a lot, so we do have a change happening now. And my goal today really is just to help you to have all your questions answered and understand exactly what's going to happen January 1st, how it's going to work. Since you're all here, you're going to be fine because it's not that complicated, but there are a few moving parts. So we want to make sure everyone understands what's happening. Any general questions we'll take obviously today. I'll stick around after the meeting if you have a personal question that you want to pose to me, and handle that. So a little bit about my company. We're what's known as a third-party administrator. What we do is we handle employee benefit programs for employers. We have about probably 40% of our business is with school districts in Ohio. So we have lots of experience working with school districts, and it makes up a really big part of our business. We've been around since 1980. We're located in Cleveland, Ohio. We're different from an insurance company though, because we're a small company, and the service that you see from us is very different. It's very personalized. You're going to have a claims examiner, Deb Bond is her name, and she's our claims manager. She's going to handle your account, and she's available for direct access by email or phone call, however you want to communicate with her. She'll be the one that takes your phone calls. She's also the one that processes claims, and so people will get to know her. And she's already ready to take calls. You guys, we know who you are. We've got all your information. There's a number that's put up here. It's also on the contact sheets that everybody should take before they leave up front here. But when you contact us and you need help from us, you call the toll-free number. You're going to come into our switchboard. They're going to say where you work. and you'll tell them you work at Botkins schools, and then they're going to transfer you over where you need to go. So it's as simple as that. Very personalized, hands-on, verbal service is what we offer, really. It's a lot different than insurance companies offer anymore. I think you'll be pleasantly surprised with that type of service that we offer to you. So, that's about it for that. That's about it on us.
You gotta walk closer.
Nope, it works.
There you go.
All right. Let's talk about prescription drugs. Anybody take prescription drugs in the room at all? A lot of people do. It's 25% of all healthcare costs are now prescription drugs. 25% of all healthcare costs are prescription drugs now in this country. So it's a big deal, and it's an important part of medical benefits, certainly. So we're going to be using CVS Caremark as the pharmacy benefit manager. So in other words, they're the ones that manage the prescriptions at the pharmacy. When you go to a pharmacy, you present your card, they process that right at the point of sale, and all happens right in front of the pharmacist there. So instead of Express Scripts was the one Anthem used. So they contracted with Express Scripts to do this function. We contract with CVS Caremark. And as Larry mentioned, very similar companies, huge. The two of them handle like 200 million people between them, so a huge, huge company. But it is a change, so we want to make sure that you understand how that's going to work going forward, starting in January. We will coordinate, help you with any issues, so feel free to call us on pharmacy issues if you want to. You can also utilize Caremark customer service. You can utilize the Caremark website. So lots of tools. They have a fantastic web app if you want to check prices of drugs. Really good tools, and you can register with Caremark starting in January. But what's going to change with that? When you think of CVS Caremark, and they're called CVS Health now, I guess is their new name. It's not CVS drugstores only, it's all the drugstores. So you can go anywhere you want, just like you do now. I mean, there could be a store here or there that's not in there, but virtually all the drugstores are in the network, just like they are with Express Scripts. So you can continue to go to the same pharmacy that you go to now. And starting in January, what you want to do is make sure your pharmacist knows that you have new coverage, that it's with Caremark now. Now you will receive a separate ID card. This is important. You'll receive a separate ID card for pharmacy. And it looks like that. It's red, CVS. Can't miss it on the front of the card. It comes in a white envelope. Don't throw it away. Don't think it's junk mail. It comes in a kind of a plain white envelope and says CVS in the corner. So that's going to come to your house probably in mid-December-ish, before January. So that'll come to your house, and you'll need to use that starting in January for prescription drugs. That's important. Make sure you remember that. We've got quite a bit of information up here on the pharmacy plan. The only thing that could possibly become an issue is if you currently utilize mail order. Does anybody do mail order in the room? Okay, so you do have to reset the mail order up with Caremark. So
The envelopes are up.
and the envelopes and instructions are up here, but you will have to change that to Caremark mail order service if you want to continue to use that. We are also adding a new feature that's pretty cool. It allows you to go to CVS drugstores for 90-day supply of maintenance medications. That's a new feature that you don't have now. But keep in mind, you can go to any drugstore, but this is something that's, if you don't want to use mail order, you can just go to CVS and get 90 days there. You can't do it at the other pharmacies, but you can go to the other pharmacies for everything else.
Or you can go to another pharmacy and do 30, right?
Sure, of course.
Still do that.
Yep, absolutely. Yep, so.
And I want to say one more thing about prescriptions. Just for simplicity, I would try and get a 90-day supply if you're happen to be going to the doctor in the next couple months.
So you don't, sometimes they charge you when you call again, call with prescription.
So the other thing I would do is get a copy of the prescription, because you'll need a new prescription to send it in with the mail order.
For mail order only.
For mail order only.
Yeah, if it's just your regular stuff, then just present that card in January, and they'll get that transferred over properly for you. Because nothing's changing with the benefit at all. We're copying the plan design and the benefits that you have now. I'm sorry, you have a question?
The 90-day at CVS would work the same as the mail order? I mean,
Ye-
either or?
Right.
You're not gonna get any more drugs on the mail order?
Is it a little cheaper?
It might be cheaper.
It might be cheaper?
Yeah.
Mail order is still gonna be cheaper?
Mail order and 90-day at CVS might be a little cheaper than buying 30.
For example, my drug was $57 a month. When I went to this, it was $17.03 for 3 months.
They didn't put your
Nope.
brand or?
Nope.
Pharmacy pricing is confusing, but that's where the website is very helpful because they once you're in the system, you can go on that site. They have a mobile app for your phone. You can price drugs and do that kind of thing. You should be using coupons if you can. There's a lot of manufacturer coupons out there for if you're on a high cost drug. You should be taking advantage of those too. There is, I want to mention, there's something called a formulary in all pharmacy plans. It's a list of preferred drugs. Express Script has one, Caremark has one. They're going to be slightly different. The main thing to be concerned with, because this doesn't list all the drugs in the world at all. It lists the preferred drugs, and then it has a list of drugs that are excluded from the formulary and alternatives to those drugs. So those are really the only ones you need to be concerned about is if they're excluded. If they're not a preferred brand name drug, they're still covered, they're just not going to be in this list. And again, you can go on the website and verify all that stuff when the time comes too. So that's what this is for. And stuff on the app and how to use the pharmacy thing. So, any other questions on pharmacy?
Okay, you said you have to get a whole new prescription if you're using mail order.
Correct.
So nothing of that transfers, like, you can't go to the CVS, just go and get your prescription filled without taking a new script?
At the store you can.
At the store, even what's left on my old prescription?
Yeah, you could. Those will transfer. It's only if you're using the mail order service
Okay.
where you're getting them delivered to your house through the mail.
Okay,
And you want to continue to do that. Do you have to re-enroll?
okay, but otherwise you can go to the store and do it.
Otherwise, you're good to go.
And your
Absolutely.
prescription's still good?
Yep.
Okay,
Absolutely.
okay.
Yep. Sure thing. Okay, so that's the pharmacy piece, and that's again, that's the one we just want to make sure you're aware of. So, watch for that new card, and if you need mail order, then you will have to do something. This is more on the CVS app. You do refills, and you can get temporary ID cards if you need them. All kinds of stuff you can do on there. It's a good site, good website. Do you use the Express Scripts website now, everybody, or not so much? Yeah, Caremark's really good. All right, so that's the pharmacy piece. Now the medical providers, and this is where I want to just be real clear on what's going on. We're your claims administrator. We're going to provide your customer service. Medical Mutual is just the provider network. So what we're doing is we have access to the Medical Mutual provider network, our company. We do a lot of business with them, with other schools and other groups. And the reason we're doing that is to get the discounts. So in the medical provider world, it's a crazy business, but usually the discounts are like 50% of bill charges or more that Medical Mutual gets us. And that's why you want to always stay in the network, and you want to get the advantage of those big discounts. And that's what we're leasing. We get access to that network, but you don't have Medical Mutual insurance. You have self-funded plans where you're claims administrator, and you're in you're in the Shelby County Consortium plan. That's the plan. We're actually going to put your school name on your ID cards. But Medical Mutual is not the insurance company, so don't call Medical Mutual, and your providers can't call Medical Mutual either. They have to call us, because all we're again using them for is the discounts. So we're getting those big steep discounts like other Medical Mutual customers, but it's not Medical Mutual. They're not involved at all. So just be aware of that. That's important. We're going to distribute actually ID cards for the medical. So again, you're going to have 2 ID cards. We're going to distribute the medical ID card in November here at school. And on that medical ID card, it'll have the self-funded plans logo. It'll also have the medical mutual logo, so the providers recognize that. And then on the back side's all the instructions on where to send claims, and so they know what to do. So that's it with the medical. So it's a network of providers, it's Medical Mutual's network, and we're simply using it to get those big discounts. Okay, any questions about that at all?
So if we're looking for our doctors that we have now, do we go to the medical mutual?
That's where,
website?
yeah, the information on the doc, great question, and I think that's in the next.
Can we actually look in that
Right
website
here.
if we don't have, like, if we're not enrolled?
No more.
in the- Did not be like.
I tried previously and I couldn't find our doctor, but I went to that website and I found our doctor.
Yeah, the Medical Mutual Network, Medical Mutual is the largest insurance company in Ohio, and so their network is very extensive. So we're not seeing or experiencing people that are having any issues with having their providers in that network as well. But you do have to go to Medical Mutual's site to look up providers. Because they maintain that site. Okay. Everybody clear on that? All right. You guys are good students. All right, so that's medical providers. And then here we beat this to death, but the key points here, there's no change in your benefit plan. So your coverage remains the same as it is now. We're gonna be your claims administrator, and essentially we're your insurance company. So you call us for help. We've got the Medical Mutual Network to get the discounts on the medical providers. We've got a new CVS Caremark drug card coming to your house. And the medical card's gonna be distributed here at school, 2 cards. That's about it. So now I'm gonna turn it back to Larry to review HSA information, and I'll be around afterwards if you have some questions.
Do we get medical cards just like one or one for each person in, like, or?
Generally, you get 1 if you have single coverage, and you get 2 if you have family coverage, but you can always get more. Just ask us if you need more.
Yeah, you just call the first number up here, the 800 number, and request another card. As soon as you get your first ones in mid-November.
Yeah, and as Larry mentioned before, we're taking the Anthem information, we're loading it into our eligibility database to produce the ID cards. We're also gonna produce a sheet of paper that basically has your address, what your current coverage is, your dependents, names, dates of birth. And we want everyone to look at that piece of paper and verify that that information is accurate. Because we're getting it from Anthem, we're putting it in our system, we wanna make sure it's accurate, because the ID card is gonna be based on that information. We've already had that for at least 2 weeks now. So if there's any change between now and the end of the year, we're not gonna have them, because the data we got was 2 weeks ago. Right, so look for that. That piece of paper will come first part of November, and we want everyone to verify that information, or if it's wrong, change it, sign it, turn it back in to Jody. Okay, any other questions right now for me? Thanks.
I just wanted to include some HSA information, because I think I met with you like 4 years ago when we all started changing over to HSA. Jody will give you these slides. Sure. How do you use it? Simple. Like that. Here's some more eligible expenses. I mean, I'm always forgetting, you can buy sunscreen tax-free through your HSA account. Let's see, the maximums this year that you can put into an HSA account, $3,450 and $6,900. And that's a combination of what the board puts in and what you put in. I'm not sure what those numbers are. Oh, but that's the max that can go into the account. A lot of people try to max out their HSA account because it's the only other place besides a 529 education account where you can put money in, pull money out if you use it for qualified medical, dental, and vision, and never pay tax on it. So you're pretty much getting a 30% discount on all this. These require a doctor's note on this side. You need to go to the health club every week, so we'll get a doctor's note. And over here requires a valid prescription. These are ineligible expenses. We're going to send this all to you in an email. You can also, some people don't know, you can pay premiums out of this. COBRA premiums if you have to leave, or long-term care insurance, Medicare and retiree premiums. We'll send this slide to you too. The other thing, they have a thing called the shoebox rule. Let's say I was going to Mexico this winter and I bought a bunch of sunscreen, and but I used my regular credit card. I didn't use my HSA card, so I forgot. So I can always pay myself back. All I have to do is put those receipts in a shoebox. I can take the money out of my bank account and pay myself back, or out of the HSA and pay myself. Any questions on that? And then how you do that is you just keep track of that in the shoebox, and at the end of the year you go, oh, I had $800 where I used my own and pulled it out of the HSA account. And you put that $800 right on the front of your 1040 tax return. Comes right off your income. Because right now, is everybody contributing to the IRA or HSA, Jody? Or?
Quite a few that are.
Okay, those dollars come out tax-free, payroll deduction. You can also add money to your HSA account if you need to during, so you want to have, what's that, an elective surgery. It's going to be $3,000. Or what is that? LASIK for your eyes, let's say. And you want to pay for it tax-free. You can take $3,000 here, move it into your HSA account, and then pay for it out of the HSA account, and then take the $3,000 off your taxes. Comes right off the top. Any questions on that?
And Larry, just to be clear, that's not a change from our HSA from before, correct?
No, these are all HSA rules that have been in place a long time. It's just that I was just going to review them a little bit. There's a one-time, that same situation. You used to work somewhere else and you had an IRA, all right? You can roll that IRA into this one time into the HSA account, okay? You can't go past the $6,900 or $7,900 if you're over 55. But you could roll that money in, that $3,000 from your IRA, and go ahead and pay for your LASIK surgery. Now, why would you want to do that? Well, when you take money out of your IRA down the road, you're going to pay tax on it. This way, you've never paid tax on that. Okay? Just a couple things. This sheet will be coming to you. So this is your plan. This hasn't changed. Just a review. 2,000 single deductible. If you're a family, which is anything other than a single, it's 4,000, and after that it's covered at 100%. You know, the preventative is covered, flu shots and all that is covered at 100% without the deductible. So get your annual physicals. There is one other plan available, and it's a minimal essential plan. 6,300 and 12,000. Kind of looks like a Obamacare coverage. That's what those plans look like. This is the dental plan. With Anthem, you had what's called a blind network. So basically, if you happen to go one of the Anthem providers, you'd get a little better deal. But basically, they're covered the same. It's 100% preventative. Deductible waived, 80% for basic, 60% for major. There's your crowns, and you got 60% on ortho. $1,000 ortho lifetime max. Annual benefit per person, so you got 3 in a family, they each get $1,500. We also have a blind network, it's called Dentamax. It basically would give you a better pricing because just like Medical Mutual, they cut a better deal with the dentist. You don't have to go to those dentists, just like most people didn't even know there was a blind network with Anthem. If you're interested in that, he's got a brochure up here. Maybe you don't even go to the dentist, or looking for a new dentist, you can go on to Dentamax website and get a better deal. Or you don't have to, you still get the same coverage.
And if I could add just
Sure,
a
add.
quick comment on that. Just to keep things clear, again, we're the administrator of the dental claims as well. Dental claims are gonna come to us. Again, nothing to do with Medical Mutual at all. As Larry mentioned, we have placed a network behind the scenes to help you out. And the way that would work, you think about, a major service is covered at 60%, so you're paying 40% of that, right? A crown typically today is like $1,000, so you're gonna pay $400 of that crown. With the Dentamax network, and there's examples on here of how that works, but they're probably only gonna be allowing maybe $700 for a crown. So instead of paying 40% of a $1,000 crown, you're gonna pay 40% of a $700 crown. So you can save some money, especially on major services, and you're not required to do that, right? So you can go anywhere, to any dentist, there's no requirement. But if you happen to fall into a Dentamax provider without even your knowledge, we're gonna take the discount for you. If you want to consider who they are, then it's real easy. They've got a simple little website to look up dentists. Just another thing to help you with your costs. Not required. We do it all behind the scenes. All the claims come to us, so it's real easy and real simple to use. But we wanted to make mention of that.
We have a new employee assistance program. I just got on the website again today, but it has counseling services, depression, marriage services, stress management, anxiety, conflict management, weight management, communication. And it's got a whole section on legal, divorce, real estate transactions, wills and powers of attorney. I mean, you can go in there and get a sample will and a sample power of attorney, and if you wanted to go see an attorney to sign off on it, you'd have your ducks in a row when you went to the meeting, so you're not there with the clock ticking, that's what I wanted to say. Identity theft recovery, how to work that, civil lawsuits, contracts, financial services, saving for college, debt consolidation, mortgage, there's a whole list, estate planning, family budgeting and all that. It's a great website, it comes with your program. You've got 5 visits, you can also do telephonic, Skype, or some of the other services that you can get on. That's your EAP program, and it's on the contact list here with the website.
That's not like Ask a Nurse or whatever, that like Ask a Nurse
No.
would be something else with the medical, or I don't know if you guys have it.
No, it's not
I would be free.
nurse line. We also have a wellness program, and right now it's a voluntary program. A lot of companies are in schools and everybody's going to a wellness program. It's voluntary. All kinds of programs are on here. I encourage you to go on the website and go through it. It's got everything. Weight loss, stop smoking, stress management, all these different programs that you can interact with them and all that.
Larry, will we get, like, in the past, we got kind of a budget that I could run programs through school for awards, like,
I'm giving out $422 for this. Are we gonna have the ability to do that with this?
Not yet. Not yet. I'm pushing it. But right now, we don't have one. Last Anthem gave us, basically what Shelby County Consortium did is they gave Anthem additional money in the budget, and then Anthem turned around and had us use it for wellness. So it will probably be the same thing, and they'd have to vote on it, okay? And it's kind of, would work the same way. You would get certain points, and if you met those points, then you get your, like you fill out you go online, a health risk assessment to start out with, and then if you did the walking program, you get more and more points. The good thing about this wellness program is if we get, as years go on and months go on, we promote it. If more people that do it across the consortium, the lower the insurance rates go. I mean, they actually take the points we got and lower the rate. So if we can get people to do that, plus, you know, being healthy is good deal too. That's just more on the wellness program. Okay, this is the contact sheet, just to review it real quick. If you have claim situation starting January 1 and you wanna, you got the claim back, you weren't sure, you know, how it was paid, you can get on the website there and set up a login and look at your claims. Or you can call Deb Mazzio. Find a Doctor is the Medical Mutual. CVS Caremark. You can go on the internet or load it on your phone. I happen to have Anthem right now, and it gives me a ding on Express Scripts. I renew my prescription. They give me a ding for my wife's prescription. I just renew it on my phone. Otherwise, I forget, and then all of a sudden they sent me an email back saying, we got your thing. Same with CVS. You get that thing set up. I like it because it doesn't, I don't have to go to the pharmacy and spend all the other money that I wouldn't have spent by going and pick up my prescription. You got VSP for the vision, phone number and website, EAP program. You really should go on that website and see all the different services they have because it comes with it, and then the wellness program. And that's pretty much all I had. Did you have anything else, Jeff? Any other questions? Or? Sure.
The vision, it was always with VSP. Do you accept the claims for vision, or do those go straight to VSP?
VSP, that's a
separate.
That's still the same.
Okay.
That hasn't changed. I just put that on there for
Okay, I was just
convenience.
checking.
Just
Thanks.
keep everything together.
And I'm sure there's gonna be more questions as this thing rolls along a little bit. We're trying to keep, you know, the benefits and the coverages as best we can, the same as what you guys have had. This really is just our attempt to save some money, and also, you know, provide you continued, what I think is a great insurance cost. So, if you guys have questions down the road, feel free to ask me, and we will know that we can get a hold of Jeff and Larry. They're pretty good at getting back to us, and Jen as well. You know, I'm sure that they'll help us any way we can this transition. So.